Ong, your student nurse for today. So I will be performing a return demonstration of the assessment of the mouth and oropharynx, the nose and sinuses, the thorax and lungs, and lastly the breast and axilla. So prior to performing the procedure, we have to gather the equipment needed and perform proper hand hygiene. So after that, we can now proceed to the assessment. So may I know your name, ma'am?
I am Trixie Kyle E. Longog.
May I know your birth date?
My birthday is on August 23, 1998.
So, ma'am, I will be doing a physical assessment to ensure that everything is normal. So, and if there are any abnormalities in your body, I'm going to note them in order to prevent any further complications. So, is it okay, ma'am?
Yeah.
Ma'am, I am going to touch some parts of your body and I need your cooperation. Is that okay with your ma'am?
Yeah.
So if you feel uncomfortable, feel free to raise your concerns and of course do some of the information that I will be getting is secured and handed to the doctors. So do you have any questions before we begin, ma'am?
Nope.
Okay, but if you do have po, you can just ask me throughout the assessment. Okay, so first I will be collecting some information.
Assessing the breast and axilla.
So now, ma'am, I am going to ask you some few questions. So do you have a medication history of your breast, ma'am?
No, sir.
Okay. So if you're going to weight your breast masses, is it too heavy, moderate heavy, or light weight?
Moderate heavy.
Okay. So is there any pain or tenderness in the breast in relation to your menstrual cycle?
No.
Okay. So any discharge from nipple?
Nope.
So do you have estrogen replacement therapy?
No,
Okay.
sir.
So do you drink alcohol? Okay. Do you do high fat diet?
No.
Okay. Do you know your body mass index?
Yeah.
Okay. So do you take oral contraceptives?
No, sir.
Okay. So what is your first period occurrence, ma'am?
On the last day of the month.
Okay, last year of the month. So do you do breast self-examination after menstrual cycle, ma'am?
Yeah.
Okay. So how you do it, ma'am?
I do it when I'll use my 3 fingertips to palpate my breast
Okay.
to, in a circular manner, but starting with the axillary.
So it seems you know it. So we're going to start the assessment, sir. So first we're going to inspect your breast for size, symmetry, and contour or shape. So can you take off your shirt, sir? Okay, so the breast is in even with the chest wall, and there's no sign of breast swelling, mark, or asymmetry. So next is we're going to inspect the skin of the breast for localized discolorations of or hyperpigmentation, retraction, or dimpling. So now I'm going. Okay, so skin is in uniform in color. Now there's no also sign of localized discoloration or hyperpigmentation. So next, we're going to emphasize any retraction. So can you please raise your both arms above your head, sir? Like this. Okay. Next is, can you push your hands together with elbows flex? Like that. Okay. Next is, can you press your hand down on your hips? Okay. So the purpose of pushing the hands together and pressing your hands down on your hip is to accentuate the retraction of breast tissues. So next we're going to inspect the areola area for size, shape, symmetry, color, surface characteristics, and any masses or lesions. Okay. So your areola is round or oval and bilaterally the same. So the color is light pink to dark brown, and there's no any sign of asymmetry, mass, or lesion, and it's normal. Next is we're going to inspect your nipples for size, shape, position, color, discharge, or any lesions. Okay. Okay. So your nipples are round, inverted, and equal in size. Okay. Similar in color, soft, smooth. Both nipples are point in same direction. There's no sign of leisure, discharge, or any cracks in your nipples there. So next is we're going to palpate the axillary, subclavicular, and supraclavicular lymph nodes while the client is sitting. So give me your right arm, sir. So relax your arm. Feel any pain there? Okay. So we're going to feel any pain. Sir. Okay, so there's no sign of tenderness, masses, or nodules. So now we're going to palpate the breast for masses, tenderness, and any discharge from the nipples. So palpation of the breast is generally performed while the client is in supine position. So if the client reports a breast lump, start with a normal breast to obtain baseline data, which serve as a comparison to the repeatedly involved breast. So to enhance flattering of the breast, instruct the client to abduct the arm and place her hand behind her head. So can you put your hand behind your head, sir? Like that. So for palpation, use the palmar surface of the middle 3 fingers and make a gentle rotary motion on the breast. So I am going to use the vertical strips pattern of breast palpation. So I'm going to start the palpation, sir. You feel any pain, sir? Okay. Okay, ready to go. So there's no sign of tenderness, masses, or any discharge. So now, ma'am, we're going to do the breast self-examination. So I'm going to give you some paper. So you're going to take down some notes. So now I'm going to explain to you, ma'am, what is breast self-examination. So breast self-examination is a procedure performed by an individual to physically and visually examine herself for any changes in the breast and underarm areas of the body. So it has not shown that BSE alone can accurately determine the presence of breast cancer, Therefore, BSE should not be used in place of, but in addition to clinical breast examination performed by healthcare provider and mammography. So now, when should BSE be done? Now, a monthly self-breast exam is an important tool in detecting breast cancer early by doing BSE regularly. So you get to know how your breast normally feels so that you are more detect any changes in your body. Women should begin practicing breast self-examination by age of 20 and continue the practice throughout their lives, even during pregnancy after menopause. So become familiar with your breast. Usually look and feel so that you may notice any change from what is normal for you. So, mom, if you still menstruate, the best time to do BSE is several days or about a week after your period ends. So there are days that when your breasts are likely to be tender or swollen, um, it reminds yourself to do BSE. So if you are taking hormones, talk with your physician about when to do BSE. So the changes to be aware of. Um, Check your physician if you find any changes in breast mom that causes you concern. Changes in your breast may include development of a lump, discharge other breast milk, swelling of the breast, skin irritation or dimpling, nipple abnormalities such as pain, redness, turning inward. So now, how to do the BSE? So in front of a mirror, mom, stand in front of a mirror that is large enough for you to see your breast clearly. Check your breast for anything unusual. Check the skin for puckering, dimpling, or scaleness. Look for a discharge for the nipples. So next is watching closely in the mirror. Clasp your hands behind your hand and press hands forward. Um, Next is press your hands firmly on your hips and bend slightly toward the mirror as you pull your shoulders and elbows forward. Next, do step 2 and step 3 to check for any change in the shape or contour of your breast. As you do these steps, you should feel your chest muscle lighten. So next is gently squeeze each nipple and look for a discharge. Now mom, next is for the lying down. The breasts are best examined when you're lying down because it spreads the breast tissue evenly over the chest. So the first thing to do when lying down, lie flat on your back with one arm over your head and a pillow or folded towel under the shoulder. So this position flattens the breast and makes it easier to check. Excuse me, ma'am. So use the finger pads of the middle fingers of your left hand to press firmly on your right breast. So next, mom, is in the shower. Your fingers slide more easily over wet. So this may make lumps and other changes easier to feel. So remember to check your entire breast and underarm area, mom. So the first thing to do in the shower is to stand in the shower and use the same technique as the lying down exam. Use your right hand for your left breast, left hand for your right breast. So ma'am, report any changes or irregular to your healthcare professional immediately. So use the pads of your fingers of your other hand to check the breast and the surrounding area firmly, carefully, and thoroughly. You can use lotion or powder to help fingers glide easily over the skin. Feel for any unusual lump or mass under the skin. Feel the tissue by pressing your fingers in small overlapping areas about the size of a dime. To be sure you cover the whole breast, mom, take your time and follow the definite pattern, lines, circles, or wedges. So the important thing is to cover the whole breast, to pay special attention to the area between the breast and the underarm, including the underarm itself, mom. Check the area above the breast up to the collarbone and all the way over your shoulder. So lines, it start in the underarm area and move your fingers downward little by little until they are below the breast. Then move your fingers slightly toward the middle and slowly move back up. Go up and down until you cover your whole area. So circle, beginning at the outer edge of your breast. Move your fingers slowly around the whole breast in a circle. Move around the breast in a smaller and smaller circles. So gradually working toward the nipple, don't forget to check the underarm and the upper chest areas too. So wedges, starting at the outer edge of the breast, move your finger toward the nipple and back to the edge. Check your whole breast, covering one small wedge shaped section at a time. Be sure to check the underarm area and upper chest. So that's all, mom. Do you understand, mom?
Yes.
Assessing the mouth and oropharynx.
So now, mom, we're going to assess your mouth and oropharynx. So first, we're going to check the doctor's order, and we're going to
Assuming that we have gathered all the
needed.
equipments.
Okay, mom. So a mouth assessment is performed as a part of a patient's health assessment. The mouth is the beginning of the digestive system and is a substantial part of the respiratory tract. Before an assessment of the mouth, the patient is sometimes advised to remove any dentures. So now mom, I have some few questions for you again. When is the last time you visit your dentist?
3 days ago.
Okay, ma'am, very good. So, is there any length of time ulcers or other lesions have been present? Okay. Next is, have you using denture?
No.
Okay. Is there any medication you are taking? Okay, very good. So now, ma'am, may I ask you if is it okay to touch your mouth? Okay, so I'm going to check your inspect your lips. It is pink, soft and moist. Now I'm going to inspect your buccal mucosa, ma'am. So, okay, it's pink and smooth and no, it's moist. Next, I'm going to inspect the teeth and gum. So there's no retractions of gums and okay, so smooth and intact denture. So next, I'm going to inspect your tongue and floor of the mouth. Wait. Okay, so pink color, no lesions and raised papilla. Okay. Next is I'm going to inspect the soft and light palate. Okay, so light pink, smooth, soft palate, lighter pink, hard palate, more irregular texture. So, can you say ma'am?
Uh, uh, uh,
Okay, position in the midline of soft palate rises during vocalization, so it's normal. So now I'm going to check your oropharynx and tonsils, ma'am. So I'm going to inspect your oropharynx for color and texture. Pink and smooth posterior wall. So now I'm going to inspect the tonsils. Pink and smooth, no discharge of normal size or visible. Okay. I'm going to check your gag reflex, ma'am. Okay, gag reflex is positive. So thank you for your cooperation, ma'am.
Assessing the nose and sinuses.
So next, ma'am, I'm going to assess your nose and sinuses. So first, we're going to check the doctor's order and assemble all the equipments needed, which is nasal speculum and flashlight or pen light. So now, assessment of the face involves primarily inspection and palpation, physically examination of the nose in human is yields important findings that provide clues to genetic or congenital disorders, respiratory distress, allergies, and common pediatric respiratory problems. So, before we start, ma'am, may I ask some question, ma'am? Okay. So, do you have any allergies? No. Okay. So, do you have experience difficulty of breathing through the nose? Okay. So, do you have sinus infections? Okay. So, any injuries to nose or face? Okay. Very good. So, have you experienced nosebleeds? Okay. So, any medication taken? And lastly, do you have changes sense of the smell? Okay, very good. So now I'm going to assess your nose and sinuses. So first is I'm going to inspect your external nose for any deviations in shape, size, or color. So symmetric. So your nose is symmetric and straight, no discharge or flaring, uniform in color. So next is I'm going to go with your external. Okay, so no tender and no lesions. Okay, so now I'm going to ask you to close your mouth. Okay, so now I'm going to close your one of your nose. Okay, ma'am. Now, ma'am, can you breathe, ma'am? Okay, next. Okay, air moves freely as it through the nares. So next, I'm going to inspect your nasal cavities using a flashlight or nasal speculum. So okay. So next is there's no swelling, growths, or any discharge in your nose, ma'am. So next, I'm going to inspect the nasal septum between the nasal chambers. Okay, no lesions and nasal septum intact. So next is I'm going to check your facial sinuses. There's any, So do you feel any pain, ma'am? Okay, right here. Okay. Okay, no, not tender. So you have no sign of sinuses, ma'am. So thank you for your cooperation, ma'am.
Assessing the thorax and lungs.
So now, ma'am, we're going to start the assessment. So can you move backward, ma'am? I mean, like that. So I'm going to inspect your spinal alignment for deformities. If the client can stand from a lateral position, observe the three normal curvatures, cervical, thoracic, and lumbar. So to assess for lateral deviation of spine, observe the standing client from the rear and have the client bend forward at the waist and observe from behind. So can you stand up, mom? And move for bend forward. Okay. So okay. Okay, so spine is vertically aligned. Spinal column is straight. Okay. So stand up, mom. Okay, shoulders and the hips are the same weight. Okay, so next I'm going to palpate the posterior thorax. So now I'm going to assess the temperature and integrity of all chest skin. So for clients who have respiratory complaints, palpate all thorax areas for bulges, tenderness, or abnormal movements. Avoid deep palpation for painful areas, especially if fractured rib, is suspected. In such a case, deep palpation could lead to a displacement of the bone fragment against the lungs. But the skin intact, uniform temperature, chest wall intact, no tenderness, no masses. So next, to palpate the posterior thorax for respiratory exertion, place the palms of both your hands over the lower thorax with your thumb adjacent to the spine and your fingers stretch laterally. Okay, and also ask the client to take a deep breath while you observe the movement of your hands in any lag in movement. So can you make a can you inhale, ma'am? Okay, and one last time. Okay, so normally the my thumbs separate to 3 to 5 centimeters, so your thorax expansion is normal. Okay, so next is to palpate the thorax for vocal fermentus. The faintly perceptible vibration felt through the chest wall then when the client speaks. So place this palmar surface of your fingerprints of the ulnar aspect of your hand or closed fist on the posterior thorax, starting near the apex of the lungs. So, okay. So can you repeat the word blue moon?
Blue moon.
Okay.
Blue moon.
Next.
Blue moon.
Repeat the 2 steps, moving your hands sequentially to the base of the lungs through position BE. Low-pitched voice of males are more readily palpated than the higher-pitched voices of females. So we're all done, ma'am. Thank you.
After every assessment, we're going to document findings.